Well, will Oregon hospitals be packed with patients come December? That's the question and the warning put out today by the Oregon Health Authority if Oregonians don't slow the spread of the virus. Fox 12's Kendra Kent is live tonight at OHSU with the story, including why Idaho patients could become part of the mix now. Kendra?
Yeah, that's right, Nora. We're here at OHSU, and the hospital says they are ready to handle a surge in patients if it comes to that. Now, they say they're also ready and willing, as part of Oregon's network of hospitals, to take in patients from Idaho if that's needed, as the hospitals over there in Idaho are starting to fill up.
As the days grow darker, so do some predictions about how Oregon's healthcare system might weather the pandemic through the winter.
We're even building in additional buffer space so that we don't get stuck in that situation where we need a bed, but it's already being occupied.
OHSU says it's continuing a plan to space out minor elective procedures as it prepares for a possible surge in sick patients this winter. Friday, the Oregon Health Authority announced the highest single-day count of positive COVID-19 cases since the beginning of the pandemic and warned that Oregon hospitals could reach max capacity by mid-December if more is not done to slow down the spread of the virus. But OHSU says it's ready, saying this time around the hospital is prepared to use a robust patient surge plan developed back in the spring. More critical care beds and ventilators are available, and partnerships across the state's hospitals will allow for quick patient movement if needed. OHA's chief medical officer says Oregon hospitals are already seeing a bump in COVID patients needing beds. But it's not all doom and gloom. OHSU says so far, few of their COVID patients need critical care.
We are seeing more patients being admitted to our acute care beds, and so they're not as ill.
Another bright spot, OHA says those hospital stays are often shorter now than they were early in the pandemic.
We have certainly taken a lot of the innovation that we've been learning about different medical treatments that can shorten hospitalizations and have implemented a lot of those.
But for Oregon, the anxiety is still there. How the weeks and months ahead will unfold is now the focus as the state hopes to again avoid another catastrophe.
And OHSU told me tonight they have not been asked to accept any patients from Idaho at this point. However, again, they say that they are willing to help out and ready to help out if needed. Reporting live tonight in Southwest Portland, Kendra Kent, Fox 12 Oregon.